It is our privilege to welcome Dr. Srinivasa Rao Surapaneni, a distinguished aesthetic and plastic surgeon with decades of experience.
Nowadays, everyone want to appear younger to their age, or they want to lead a healthier life, and also proper weight management, especially country like India, because of the regulatory bodies are not so strict and stringent. There are so many unlabeled or untrained doctors coming into the field of cosmetics. Fillers means that these are synthetic injections that have come into the medical field. Whereas these kind of injections like potax, which can minimize the wrinkles on your face, and also the fillers, which can increase the volume of the nose. Usually, we can even increase or improve the lip profile. When you smile, the lateral angles of the lip has to go up.
Difference between the potax and the filler? Potax is an injection kind of thing.
Yeah, both are injections only. That's the reason common people, they'll have a lot of confusion. They think they are more or less same, but they are entirely different. By filling this one, the skin is being pulled from the below the eye. You can see the wrinkles has come down. But unfortunately, especially in Telugu speaking states, few movies have popularized it as carry bags. So for the carry bags, this is not the answer. For the carry bags, we have to do a surgical procedure. I would like to start with nowadays, because the cosmetic surgery is evolving like anything, and people are more keen about what to do, what not to do, or obviously most of the news journals, there will be a message whenever there is a kind of a faulty thing that happens to any celebrity or any kind of a thing. So people always come to me and pinpoint that particular issue, saying that so-and-so has happened, or so-and-so happened to have this kind of an issue or some problem following the procedures, or it includes at times risk to life, or unable to reach to the expected corrections and all these things. So that's the reason I just want to give this talk to inform the people. It is as simple as like this. For example, if you happen to read about a kind of an accident today in the newspaper, that means not only that vehicle is running on the road, there will be another millions of motor vehicles must be running on the road. There may be an accident with one or two in a day in a significant way. So in the same way, any procedure has got its own risk and this thing. But coming to the point, when it is being done in a proper way, in a proper facility by a well-trained doctor, usually the kind of unwanted results or problems can be minimized. So that's what is the assurance that I want to give today. Nowadays, everyone want to appear younger to their age, or they want to lead a healthier life, and also with a kind of a proper weight management. So that is another chapter that also we are going to address. In the same way, nowadays the medical practice, the hair transplants are increasing more and more. So unfortunately, in some of the, especially country like India, because of the regulatory bodies are not so strict and stringent, there are so many unlabeled or untrained doctors coming into the field of cosmetics, and they are also trying to do certain procedures. Yeah, recent past we have seen some of the hair transplants also giving a lot of troubles for the health, and as well as the results coming from the top, the face, the nose. Fillers means that these are synthetic injections that have come into the medical field, like hyaluronic acid. So these fillers can be used to rejuvenate the face. Suppose if there is a significant weight loss, there will be a lot of fat loss from the face. So these are all newer things that are coming with a lesser intervention. But by and large, the medicine, without an intervention, there is nothing. Just by taking a pill itself is not going to correct every aspect of our desire or shape or size or something like that. But however, the newer techniques are giving a comfort, like with a minimal intervention, we can give them the maximum benefit. Like unlike olden days where you have to hospitalize or undergo surgery, means there will be some downtime and other things. But whereas these kind of an injections like Botox, which can minimize the wrinkles on your face, and also the fillers, which can increase the volume of the nose. These are all OPD procedures. That means daycare procedures. That means you need not be hospitalized. It is just in some countries even they promote it like um, lunch on sessions, like the afternoon and the lunch break. They are giving all these kinds of procedures, doing these procedures in various clinics all over the world. This is I'm sharing you some slides of Botox. Hope you all able to see it well. So here, basically, middle-aged lady, she wanted some improvement of the face. So as you see, you can see the eyebrow, the lateral portion has been elevated a little bit than the previous. And especially when they want to give some expressions, those can be settled, and those wrinkles can be avoided. Like so, like when you want to frown, and you ask to twist your eyes to the side, usually it happens along with the frowning. So now that is not there. And usually when you look up, there will be some wrinkles forming on the forehead. You can see the deflection of the eye is more in the after the procedure, but absolutely there is no wrinkles at all. The same way we call this as a crow feet. So when we inject Botox, usually you can smudge all these fine wrinkles on the face. This is the other side of the eye, and usually we can even increase or improve the lip profile. When you smile, the lateral angles of the lip has to go up. So usually as you age, the lip contour will be more towards the down. So instead of that, this can be done. And these are some more examples of before and after the Botox and the forehead and the vertical frown lines. So like that, these are all office-based procedures. These can be done in a half an hour or 20 minutes time. And usually it will take about a few days to set in.
I have a quick question. What is the difference between the Botox and the filler? Botox is an injection kind of thing.
Yeah, both are injections only. That's the reason common people, they'll have a lot of confusion. They think they are more or less same, but they are entirely different. Botox is the one which is going to block your neuromuscular junctions, technically speaking. So even if you want to express some of the your facial expressions can be minimized, like frowning or when you smile, the wrinkles that happens on the sides of the face, those kind of things. Whereas when it comes to the fillers, I'll show you the filler slide also. Now, as you see the lips, this is done with fillers. In a common man's understanding, filler is such a one, we are trying to augment the tissue. It is not blocking the neuromuscular junction or anything like that. For example, in this guard, the upper lip is thinner than the lower lip. If you see the first slide. So we increase the upper lip to maintain the equality with the lower lip. So for example, in a side profile, if you look at, the upper lip is receding back, but whereas in a normal profile, the upper lip should be a bit more projected than the lower lip. So this is what is the filler like. And
so you can localize the filler, right?
Yeah, both Botox and this thing is a localized way only. But usually wherever we want, we can increase that area. I'll show you another example. So here, this is a very young girl, had to be married, but because of the marriage or something, she wanted to lose some weight. She started exercising more. You can see this infraorbital area where there is a kind of a depression on both the sides that has been increased with the filler underneath the eye. So this is another patient, more or less same, but a lesser version of it. So this is how we design, and this is how we fill it in the third picture. So you can see now more clearly, this is before, this is after. Are you able to see my cursor?
Yes.
Rishabh?
Yes, sir.
Yeah.
Yes.
Yeah, this is the area I filled it like. So again, the same. This, if you ask me, about 50% of Indian population who are more than 30, 35 years will have this. So all of them, they can have the correction, but that depends upon their requirement. You can see by filling this one, the skin is being pulled from the below the eye. You can see the wrinkles has come down because it is when you fill that area, the skin is going to be pulled from that area to the neighboring areas because of the filling. So here also very young girl. So she wanted some improvement in the underneath the eye. Usually these eye around the eye, the defects can be well visualized when you are rotating your eyes to the side, because at that time it causes some pressure into the socket, and that try to drive out the fat bulges left and right. So that is the reason you can see the sometimes the other side of it is somebody who is older than 50, 60 years, they might have the, well, what I can say, the bulges, which we call as in medical terms as festoons. But unfortunately, especially in Telugu-speaking states, few movies have popularized it as carry bags. So for the carry bags, this is not the answer. For the carry bags, we have to do a surgical procedure. So here you can see there is a bag here, there is a bag here, there is a bag here, there is a bag here. Of course, this is after the surgery. This is where we make a cut and we go inside and remove those fat pouches and come out. And also just, as I said before, when you twist your eyes, you can see the eye bags, these carry bags or festoons protruding out a bit more than normal like. So this is happens in a surgical way. And in addition to that, I have done some skin cleaning. You can see some of these black heads and black marks, and it's been removed. So you can see all these black pigments are gone from his face. So he looks more better. And in addition to that, most of you must have not noticed. If you look at his upper eyelid, can you see this right side upper eyelid is almost like coming and falling like a second trap onto the eye. And here it is very minimal eyelid or eyelashes are seen like. Here it is almost falling onto eyelashes. So whereas here it is not like that. This is also, we do a, this surgery is called basically blepharoplasty. Superior means upper eyelid blepharoplasty, inferior means lower eyelid blepharoplasty. So here I have done on both. You can see the increase of the margin here, and also improvement of this one here. So with this, we can give a little bit pleasant looking eyes like, okay. So if you compare both the eyes, here it looks more serious or more depressed or something, whereas here it looks more, how do you say, more attentive or attractive, something like that. Yeah, this is to address the post-pregnancy, something related with mummy makeovers or massive weight loss. So usually we try to perform this surgery. So here basically, if you look at, we remove this much portion of the skin, and this particular point of the skin goes to this area. So that is the reason you can see the crease is gone and there is a lot of tightness of the skin. And though it is a bikini scar, and we also recreate the umbilicus, and internally we repair the muscles. So you can see the improvement in the hourglass shape. So now she's with a better body contour. And on the side view, usually these are the most, wrinkled skin, and that is gone. And I could able to remove some portion of the stretch marks, but not the 100%. But normally, this kind of a stripe profile of the abdomen is called washboard abdomen. Washboard means no humps and bumps on the abdomen like. So this is a abdominoplasty in a massive weight loss, and this is the umbilical scar. This is a new umbilicus we create. These are extended abdominoplasties. That means where I go until the back to correct the thing like. For example, if I had not gone to the back, I would have not addressed this love handle bump. So this is another way of extended abdominoplasties. Yeah, this is about a 60-year-old male. he came to me with weight loss and a hanging abdomen. So we have corrected. This is the scar line. This is the new umbilicus. And he also has a demand that he wanted to go with a party shirts. So he doesn't want these love handles to be prominent. So we went until the back and removed it. Yeah, this is the arms or brachioplasty in medical terms. We also call as arm lift. So when there is a massive weight loss, there will be a lot of hanging of the loose skin. So this is the kind of a thing. She's an African girl who had a bariatric surgery, and this is the cut line, and this is how it is going to improvise. So in the same way, we extend onto the chest to give some corrections. Yeah, here it is a pictorial representation, so I can discuss. So we cut this area and also infra-axillary area and also the breast area, and we can lift it up. Yeah, basically, this is how we design. You can see the scar here underneath the chest for the breast lift, and this is the scar for the correction of infra-axillary area and arm area. Yeah, this is a jawline chiseling, we say. The top two pictures are before, these bottom pictures are after. So probably we try to make it, the jawline look more prominent. So in front of camera, when you're working, you feel more confident or more comfortable, or the way you look like, or the way you want to look, it is going to happen like. Now come to this kind of a male boob or a male gynecomastia, we call it. So this is the male chest that has been corrected like. So you can see now the projection is gone, and now he will not have any. Usually these kind of boys, they try to sit in a little bit hunchy fashion. They don't sit straight. They try to cover their chest. They try to sit in a very crooked way. These are few other examples. So sometimes we may do it in a semi-open shape. That means we just open underneath the areola here. You don't see any marks here, but you can see the improvement on the chest. So here, if you look at, the chest is forward than tummy. Here it is almost at par or less than the tummy.